Temperatures are soaring high and we are all facing the heat. In the last couple of days, I've come across 4 children who presented with nosebleed. Now, this brings a very interesting question among the parents. Should we be alarmed? Should we investigate the child? How do we go about it? I am Dr. Srikanth Marda, Pediatric Hematologist and Oncologist at Ankura Hospital, Kukatpalli. Today, I would want to talk about alarming signs which we need to be aware of in a bleeding child. Nosebleed, that is epistaxis, is very commonly seen, and the cause being because of the dry nasal cavity or a local pathology or a trauma over the area, or more commonly we see the habit of nose pricking. In majority of the children where the amount of bleed is very minimal and a major intervention is not required, just supportive care and follow-up would suffice. But what are the alarming signs or the red flag signs which we need to be aware of where there can be underlying inherited bleeding disorder? So those would be if there are repeated episodes of bleeding and bleeding from multiple sites, like apart from the nose, bleeding from the oral cavity or in the urine or in the stools. And the amount of bleed which is very significant. Sometimes they come with the bleeds where kerchiefs or the tissue papers are filled up with blood. So that definitely becomes alarming. And if a specific major intervention is needed to control the bleeding, and it is not spontaneously resolving. If there is history of prolonged bleeding just post to trivial trauma or injuries, or if there is a post-vaccination or post-injection site hematomas. If there is family history of similar episodes of significant bleeding, then that would be significant. So in all such above cases, there could be a low platelet which could be causing the problem, or a inherited bleeding or coagulation disorder, or a platelet function defects per se. So consult your pediatric hematologist, as they would be the better persons to guide through whether they need to investigate or not, and accordingly plan the treatment. Encourage plenty of liquids, stay hydrated, stay strong. Thank you.